practitioners for ear acupuncture, auricular acupuncture, have developed their favorite points to use during the COVID epidemic, as well as post-COVID. And I developed this incredible new respect for point zero. And I've probably appreciated point zero a little bit more than Shen Men. For me, point zero, almost 100% of all the treatments right now. Once we had Paul Nogier's early mapping for the upside down fetus, the area of point zero was around the umbilical cord, or it was the center of the umbilical cord. So it only makes sense to take sociologic and anthropologic customs and to apply them in a healing fashion to how we use point zero. With COVID, we've had PTSD resurface. We've had old trauma from childhood just suddenly throw them off. We've had patients return to a war-torn country overseas. Somewhere along the line with my students, I started referring to point zero as the mother point. So far, I've not been able to find anyone else who's heard point zero referred to as the mother point. But if we're going through grief, for me, it's the first point before I start checking for what other active points should be included in that day's treatment. Some of the other international maps, the Italian Dr. Romoli that had the sectogram. Point zero was the center, and you had all these pieces of the pie radiating off. And there are times when you're working on a point protocol for a patient, and you see that your needles are lining up in one of these sectograms. The segmentogram is by David Alimi. The sectogram is by Romoli. So why this leaning, why this pull, this attraction? And I think for me, it became the symbolism, the cultural awareness of different patients and their desires to return to their roots. For instance, Aboriginal societies, Native American tribes, even Hawaiian ethnic groups, Ugandan ethnic groups. There are a lot of rituals surrounding the umbilical cord and what it represents for the baby, and how many women are returning to some of the ancient practices. In Native American tribes, the umbilical cord was saved, and it was either dried and put in an amulet, or else the umbilical cord from the baby was buried near the home or on sacred ground. In Japanese culture, the umbilical cord could be saved in a beautiful decorated box and kept in a special area like a shrine in the house. What was the purpose of treating the umbilical cord like this? It was for that young person, that child, that baby growing into an adult, to be grounded in their own culture, but also to return home. And I have to ask, each and every one of us right now, as we recover from this global pandemic, isn't that secretly and deep down inside what we want? We want to return to home. We want to return to our grounding. We want to salvage that relationship with the earth, with our soul. In other words, it's the symbolism of point zero that I feel is one of the reasons it's becoming such an important point in healing right now.
Tying ideas together between a filter of a self-heal frequency, which is filtering out and finding baseline weaknesses being or residing in TCM conceptually as foundationally having to do with the middle burner, and the middle burner for point zero being a major point in the treatment of indications for these weaknesses in the middle burner. Tying these concepts together, maybe you can provide some medical appreciation of the value of this metaphor.
The way I would tie the teachings you described together would be to give a case example.
Mhm.
A woman, she wants to be treated for her low adrenal. She says, I'm so stressed. My mother just died. I took care of her through hospice. I now have all of the family business to wrap up. And she's just talking about put a needle in my adrenal gland, put a needle here. She has enough knowledge of ear acupuncture points where she wants certain points. And it's part of the art of medicine to assuage her and say, yes, we're going to treat your adrenal glands, but that's a part of a higher axis. And again, sticking one needle in French adrenal or the German adrenal or the TCM adrenal on her ear isn't what she needs when you listen to the ear. So when I start looking and listening to her ear, she's in crisis in terms of her whole emotional well-being. She's grieving. This has been a long, drawn-on process. You can see where she's not sleeping well. And if you're just using a protocol where you're treating the most active and the most important points, we ended up where it was point zero, autonomic, and something in the cavum concha for the vagus nerve. So that could be a traditional Samjiao, that could be lung 1, lung 2, it could be the Chinese heart point. But what I'm doing and teaching is if somebody comes in after the death of the mother, I'm certainly going to be looking at grief using point zero and trying to get the vagus sympathetic, parasympathetic regulation back. And the patient's going to be seen in another week or two. And we just assure her that this theory work is going to help her. It's going to get her back to where she needs to be. But if you don't start working with the grief, you're not going to get to the root cause. So the way I'm tying this together, we as ear acupuncturists, auriculotherapists, we have to sift through what the patient is saying, treat what the ear is telling us right then and there through visualization, pressure point tenderness, through pulse methods such as BOSS or an electrical point detector method. But until you clear away that current trauma, you will never get to the root cause.